ready? Susie, you ready?
In a little bit. Are you ready? Nothing. We don't have anybody yet. Yeah, I'm checking with Gloriana. You ready? Yeah, we're ready.
Go ahead and like to call to order the District Board of Health meeting for Thursday, January 26th, 2023 at 1 o'clock. And if we could, start off with a roll call and determination of quorum, please.
Yes. Chair Adair will be absent. Vice Chair Brown.
Here.
Devin Reese will be coming in late. Dr. Denko.
Here.
Dr. Novak. Here. Dr. Clacking.
Here.
And Commissioner Garcia will be absent, and I am your recording secretary. We have a quorum.
Thank you. Well, we're going to welcome Commissioner Garcia, but I understand she's not going to be able to make it, so we'll just hold off on that welcome till the next meeting. So that's good to hear. Number 2, the Pledge of Allegiance. Barry, could you please lead us in our Pledge of Allegiance? Thank you, Barry. So item number 4 is the election of District Board of Health Chair for the 23-24 season year. And I know that there's been interest we've discussed amongst us, and now we'd like to go ahead and see what we can do as far as trying to get somebody nominated to these positions. So,
Mr. Chair, I would like to make a motion to nominate Christopher Dare as our new or continued chair of the Health Board.
okay, a nomination for Commissioner or City Councilman Dare. Do we have a second?
I'll make the second.
Second by Dr. Danko. All in favor, please signify by saying aye.
Aye.
And any discussion? Okay. And public comment? Okay. Thanks for keeping me in line over there.
We don't have any public comment.
Okay, no public comment. It was
But if
agreed
you
by-
could please vote on your iPads.
Okay, it's unanimous. Okay, City Councilman Dare will be our chair. And I know he'll be attending meetings here in the future due to his time off right now, but I know that Councilman Chair is very excited about the potential of staying on as a board member, so thank you. Second part of this, number 5, is the election of District Board of Health Vice Chair for the same year, 23-24. And I know after talking with Councilman Reese, he was interested in filling that position. So if there's any potential, somebody could give us a motion for that.
I would motion.
Okay. Motion by Dr. Novak, second by Dr. Clacking. Is there any public comment on this?
No public comment.
Okay, seeing how there's no public comment, I'll signify by saying aye.
Aye.
Aye. And please vote. And as Councilman Reese shows up, we'll go ahead and pass the gavel to him once he gets here, but we'll go ahead and continue on. Item number 6 is approval of the agenda. I didn't hear of anything that was going to be removed, added, so could we get an approval on the agenda?
So moved.
Second.
Second approval by Dr. Novak, second by Dr. Danko. Any public comment on this?
Yes.
Seeing none, all in favor signify by saying aye.
Aye.
Any nays? Okay, motion carries.
Chair, if I could just have 1 second.
Okay. Motion carries for the agenda. Good.
And Chair, will we take a recess when Vice Chair Reese comes in so we can change the roles, or? we're good?
Sounds good, we'll do.
Okay. And you will continue as acting?
Yes.
Okay.
All right, item number 7 is recognitions. Our District Health Officer, Kevin Dick.
Thank you. I'd like to begin with recognitions of district board members who have been reappointed to the board. So I want to congratulate Dr. John Novak for his reappointment as the Sparks non-elected member of the board. Congratulations. Also, I'd like to congratulate Chief Mike Brown for his reappointment as the Reno non-elected member to the board. Congratulations, and thank you both for continuing. And then I'd also like to recognize Commissioner Alexis Hill for her service on the board. So her service ended in December with Commissioner Garcia now joining the board as the elected representative from Washoe County. Also have years of service recognition. Want to recognize Sheila McCoy. Sheila is not able to be with us today, but I want to recognize her for her years of service, 5 years of service from January 22nd of 2018 in CCHS. And then also I'd like to recognize Cynthia Arredondo, who has been with us for 10 years now, joined us in January of 23rd of 2013 in CCHS. I believe Cynthia's here. Oh, there she is. Congratulations and thank you for your years of service. And we have several new hires in environmental health. And so I'd like to ask Erin Dixon if she could introduce us to a couple of new environmental health specialist trainees who joined us on January 17th, Taylor Stokes and Erica Moore.
Good afternoon. For the record, Erin Dixon, Environmental Health Services. I am very happy to introduce our 2 most recent new hires. Mr. Taylor Stokes is a recent graduate of the University of Nevada, Reno MPH program. He grew up in Minden before moving to Reno to pursue his college education. Taylor previously worked for the local nonprofit High Sierra Health Education Center, combating all things healthcare workforce shortages, and has interest in public health education and programming. Taylor's hobbies include road trips, snowboarding, and stargazing. And when Taylor completes his initial training, he will be assigned to the Food Safety Education Outreach and Standards subprogram of our food safety program. And I'd like to introduce next to him is Ms. Erica Moore. She received her undergraduate degree from California State University, Sacramento in gerontology prior to moving to Reno to continue further her education at the University of Nevada, Reno. Her previous position was with UPS, and she will not miss next year's holiday shipping season. One of her favorite hobbies is scuba diving. Upon finishing her initial training, Erica will be assigned to the Special Events and Epidemiology subprogram of our food safety program. Welcome.
Good deal, welcome.
And then Jessie Latcha for reassignments was hoping to be here, but she's out in the field right now.
Okay. Next, I'd like to recognize Brandon Koyama, who is joining Air Quality. I'd like to, thank you, Francisco Garcia, or Francisco Vega for coming down to introduce him. Brandon is listed as a promotion. I think this is maybe some hybrid between a promotion and a new hire, as he's been with us as a public service intern, so a student intern with air quality while he was completing his degree at UNR. So I'll let Francisco introduce him.
Thank you so much. Pleased to have the opportunity to introduce Brandon Koyama as an environmental engineer within our air quality team. As Kevin mentioned, Brandon was an intern with us since September of 2021. So we were fortunate to have an opportunity for him to join us on a full-time basis after he graduated with his degree in environmental engineering in December. Brandon will be joining our permitting branch within the division, and again, just really happy to have him join us on a full-time basis.
Good deal. Welcome, Brandon.
And as Ms. Dixon noted, Jessie Latchow is not able to be here today, but she's been reassigned from an emergency response coordinator in EPHP to an environmental health specialist trainee in EHS. Congratulations to her on that. I have a special recognition this month. I wanted to recognize Diana Karlichek, and she has been recognized, and if you could stand up, Diana, she's been recognized before at our Board of Health meetings as the organizer of our Health District's Adopt a Family campaign. She's been doing this for many years for us, and it's quite an effort of getting staff organized and getting presents purchased and wrapped and delivered to the 3 families. I call her our Christmas angel, so she's worked with the Boys and Girls Club to support 3 families this season, 15 people who have had a much merrier Christmas because of her efforts. A total of 56 people at the Health District donated cash or items, cash donations of over $2,000. And we donated 50 cleaning items for all of the families, 28 hygiene items, and 173 items were wrapped, put under family trees, including 2 toddler beds. So thank you so much on behalf of the Health District and the board, Diana, for your efforts. Round of applause.
Yes, you betcha.
And then also we have a couple of our Health District Health Heroes being recognized today under our Employee Recognition Program. Jennifer Howell, Jen Howell, being recognized for professionalism and partnership and collaboration. So thank you and congratulations, Jen. And we also are recognizing Heather Burris, EHS, and also for professionalism, trustworthiness, and partnership and collaboration. So congratulations, Heather. And just a note to the board that we have already updated the Health Heroes program for nominations to reflect the new values that were included in the strategic plan that was approved in December. So you see a slightly different twist on these coming forward in future months. So that concludes our recognitions, and perhaps we can do some photos, pictures.
Vice Chair Brown, you also have certificates in your folder.
I think I've got them all.
Oh, okay.
Yeah, so if we could have people come down to the front who've been recognized. Let's start with Cynthia. Perfect. I think I got a certificate for you here, and I've got a pin for you. Sealed tightly. And I'm gonna need some assistance because one of these says 5 years and one of these says 10, so I need somebody who can read that small. I got glasses. That's 5, so that's, oh, you're 10, you're right. That's fine. There we go.
Thank you.
Thank you, Cynthia. Then let's go to Taylor and then Erica.
Thank you. Erica? Let's see, organize a scoop trip. There you go.
Technical difficulties. Okay, ready? Go, one more.
Thank you.
And Jen?
Thanks.
Good thing I know you from other.
Okay, ready? One more.
And Heather?
Now I can see. Thank you.
One more. And
Okay. Moving on to number 8, public comment.
We don't have any registered public comment.
Okay. So moving on to item number 9, COVID-19 flu RSV update and information by our Health Officer Kevin Dick and Board Rep Dr. Danko.
Yeah, thank you, Chief Brown. I have some fairly good news to report on RSV, flu, and COVID-19. For the week of January 15th through the 21st, we're reporting 34 RSV cases. So that's down from 66 cases that we had reported for the week before that. And that is down significantly from the high that we had of 263 cases in a week a couple of months ago. So pretty significant decline that's occurred. But we do have a huge number of RSV cases that we've had this season already. It's 1,891 cases that have been reported to us. And as a reminder, in a typical year, it's closer to 750, and that's for the entire season, running through the first 20 weeks of the year. For COVID-19, our 7-day moving average of new cases is at 27 per day, and we had 187 cases reported last week, so we're fairly flat at that level, and the wastewater concentrations are remaining low, which is a good indicator for us as well. Over the past 2 months, though, we have had 16 COVID-19 related deaths in Washoe County. So while the numbers are low and encouraging, we still are having people that are passing away from COVID-19. And for the flu, the most recent reporting period we have is the week of January 8th through 14th, and we saw a decrease in influenza-like illness for the 7th consecutive week. But there were 3 flu-related deaths that were reported, and we've had 18 total flu deaths reported for the season so far that started in October. So it's a fairly high number of deaths that we've had for the season to this date. So we're continuing to recommend for people to get the flu vaccine and the COVID bivalent vaccine. And as far as our hospitalizations, we've got some good news with the Nevada Hospital Association reporting pediatric hospital occupancy rates are at 92% statewide, and this is an improvement because the rates have been running 98 to 100% occupancy for 9 straight weeks prior to that. And RSV admissions are declining statewide. COVID admissions are remaining flat, and they reported 16 Washoe County COVID-19 hospitalizations as of Wednesday of this week that's for COVID-19. And our community level remains low for COVID-19. So we've had our early season spike in RSV and flu and are coming down in our numbers of COVID-19 cases, but it's really encouraging to see these numbers declining. We've got a ways to go, though, still in the flu and respiratory disease season.
Great.
I don't know if Dr. Danko would like to add.
Yeah,
to
thank
that.
you so much. Thanks for the report. I think the only thing I'll add is that this is all very good news, and it's nice to hear things declining and stabilizing. I will say that in trend, we have been for sure thrown off by viral illnesses in the past, pandemic and outside of. So let's not let the guard down. We have lots of good opportunities with vaccination. We have really good opportunities with our hand hygiene and risk mitigation measures like washing and wiping high-touch surfaces. And keeping those up helps us to prevent potentially a second spike in infection that can come in a later flu season or later COVID season. So we don't want to let the guard down as much as we want to be excited about the trends.
Thank you to our health officer and Dr. Danko for the update. Do we have any questions from the board members? Any updates? Okay, then. We're going to take a recess at this time? Okay, we get to take a recess, and I get to pass the gavel over to you as our vice chair. So we're going to take a quick recess.
Calls back into order and start the recording. First of all, my apologies to all of you for being late. I suppose it's a lesson to be learned. When you're late, they make you the vice chair of things, so perhaps don't be late in the future. But what a privilege to be with all of you today, and we'll pick up where we left off. Thank you, of course, to Mr. Brown for leading us in my absence. We'll start with item 10, I believe, the consent items. Is that true, Board Clerk? Okay, consent items. Are there any items that anyone wishes pulled from consent? Hearing none, I'll ask for a motion.
Make a motion to approve.
Second.
Okay, I have a motion by, oh, I can't see my speaker, sorry. Okay, I have a motion and a second. Any discussion? Any public comment on these items?
No public comment.
Thank you so much. I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Okay, item 11. Looks like 11A. Mr. Planis, welcome.
Good afternoon. My name is Barry Duplantis of the Regional Emergency Medical Services Authority. First item we have on agenda is item 11A, which case I'd like to introduce the members of our Board of Directors. I will announce their names, and if they would, please start moving forward. Mr. Chris Nicholas, Mr. Derek Glum, Ms. Katie Grimm, Ms. Shirley Roberts, Mr. Mike Pawnee, Mr. Louis Tess, and Ms. Cora Case. Ms. Shirley Roberts serves as our board chair. Mr. Pawnee serves as our vice chair, and Mr. Tess serves as our secretary, and Ms. Case serves as our treasurer. I'm excited to introduce them today to you. This is one of the most dynamic boards I've ever worked with in my experience of all of my professional years of work. So please welcome them.
Well, thank you. Welcome. Shirley, what a pleasure to have you. Always wonderful to see you. And you're right, Mr. Duplantis, you have the rockstar boards, a number of which I've known my entire professional career, and what a joy to be with all of you.
Well, thank you. And this is Shirley Fulkins-Roberts, Chair of the Board for the record. I have an exciting announcement today. On behalf of the Board of Directors, I'd like to let you know that we have named Barry Duplantis as our President and CEO of Remsa Health. And we are so thrilled. He not only comes with a tremendous skill set, but he also comes with passion and compassion for our Remsa's first responders and our community. And we are confident that under his leadership, Remsa has a bright future. So thank you, Barry, for serving on behalf of the community. Thank you.
Well, that is very exciting. Let me come back to the body. Does anyone up here want to make any comments?
I'd like to make a comment.
Thank you.
I just wanted to note that Cora Case is joining via Zoom. Well, she couldn't be here, so I wanted to make sure we recognized her.
I'd just like to say, Barry, thank you for bringing everybody today. Congratulations. It's going to be great working with you, and we appreciate everything you've done so far. And so thank you. The dialogue has been incredible. And to your staff and all, we appreciate that.
Thank you, sir.
I'm here. Congratulations, Barry. Looking forward to working more with you. Thank you.
Yes, thank you so much.
Thank you.
Really, really nice opportunity to work with you, and you offer so much, as you said, kindness and compassion, and we really need that, and you lead a tremendous force of healthcare heroes, so thank you for doing that.
Well, thank you very much. It's my pleasure to lead this amazing company, which is now 600 people strong. It takes a lot of people to do emergency medicine. We've got amazing people, and led by now the most dynamic board, as I said, that we could have ever assembled. I mean, this is awesome. It's an awesome time for us.
Well, thank you for both introducing us to the board, and also congratulations, of course, to you on this new role. I think they've made a sound choice, and looking forward to working with you as always. Okay, we'll move on to item 11B. 11B.
Again, my name is Barry Duplantis, now CEO and President of Remsa. I understand you've been provided with a copy of Remsa Health's December 2022 report. I'd like to highlight that for the month of December 2022 and for the fiscal year to date, Remsa Health was compliant with Priority 1 calls in zones A, B, C, and D as required by the franchise agreement. I want to note that we continue to experience year-over-year growth in demand for 911 services in our community. As the community grows and many members of the community continue to use 911 to access health care, and many of our patients, let me say, especially in the last couple of months, the percentage of patients transported to higher levels of care have been higher than what we typically see. It's been typically in the nature of 6 out of every patient being transported as opposed to 5 of every 10 patients being transported. So that's our report for today. As Councilman Reeves mentioned in the last meeting, I think you have all received the report, and if you have questions, I won't go into too much further detail, just keep it, at the surface level and acknowledge that we are compliant with all components of our franchise. I'm happy to address any questions that you may have.
Okay, let me bring it back to the board. Are there any questions or comments? Mr. Dick, do you have any questions or comments? It's hard to see that light. It's one of the hard parts of being in this room. Thank you so much. Anybody else?
I just have a quick question
Clack.
on the, since we've added in the 3-digit suicide hotline, has that changed some of the calls that are coming in on the 911? Have you seen a difference between that at all?
Difficult to say because quite candidly, the volume of inbound calls has been as high as we've ever seen. In fact, we've had a couple of days in the last 2 months that have broke records in terms of number of inbound calls. So it'd be very difficult for me to say that there's any one thing that has contributed to any reduction in calls.
Thank you.
Any additional comments? Any additional comments from the board? Madam Clerk, do we need a motion on this item?
We do. We don't have any public comment either.
Thank you so much. So I'll entertain a motion.
Motion to approve.
Second.
Okay, I have a motion by Mr. Brown, a second by Dr. Clanking and Danko, but we'll say Danko was in first. Any additional comments from the board? Hearing none, I'll close the item and call for the question. All those in favor, please signify by saying aye and marking your tablet. Aye.
Aye.
Any opposed? Motion carries unanimously. Mr. Dick, item 11C.
Yes, 11C is the update to REMS's Health Public Relations during December 2022, and we have Alexia Jobson. No, we do not. We have Adam Hines.
I am not. Good afternoon, Mr. Chairman, members of the board. Adam Hines, Executive Director for REMSA Health. I'm providing today's public relations report on behalf of Director Jobson. You have before you to review the public relations report for December. And I'm happy to share a couple things that we've been working on in our community more recently. Throughout the late December and obviously January, the region experienced significant inclement weather. REMSA Health worked to share important patient navigation and public health messages about how to stay safe, particularly for the elderly population. Messaging included reminders about being cautious when walking on snow and ice to minimize the risk of falls, since there are seniors, many of which are on blood thinners, and fall can have very severe consequences in that case, as well as not to overexert themselves when shoveling snow, as that can lead to cardiac emergencies such as heart attacks. These tips were featured on segments in local TV, KTVN, KOLO. KOLO aired a news story about REMSA Health's response operations during inclement weather, and topics included policies and procedures that prioritize the safety of our patients and our employees when responding in our community during these type of inclement weather events, the capabilities of our search and rescue paramedic team and how they work to respond and provide care to those that may be in need, and how supervisors support ground operations during inclement weather and other operational flexibilities that we ensure to have in place during those events. Alma Marin was our subject matter expert on a recent midday show on Colo. She talked about the importance of bystander CPR, very much so in the news, and very proud of the effort that REMSA Health provides access to CPR. Every 29 minutes, somebody in our community is trained in CPR by somebody that works for REMSA Health, and so we're very proud of that and how CPR and AEDs save lives. And then finally, the week of Christmas, REMSA Health, in partnership with the Washoe County Health District, launched a paid digital media campaign intended to bring awareness about the symptoms of RSV, which we're glad to see are declining in our community, and when and where to seek appropriate care. Ads and promotions on Instagram and Facebook featured illustrated images, as well as a recorded message from one of our physicians, Dr. Jeremy Gonda, who is one of our medical directors. In addition, audio ads were placed on streaming music services, All messages were created in English and Spanish, and across all platforms, we expect approximately 40,000 impressions daily, so really getting that message out there. With that, I'm available to answer any questions relative to this report.
Thank you, Mr. Hines. Always a privilege to have you in front of us. I really appreciated a number of the segments I saw on KTVN that you were a part of, so thank you for that. I'll bring it back to the board and see if there are any questions from the body. And then, Madam Clerk, any public comment on this item?
No public comment is not an action item.
Hearing no public comment, I'll close this item then at this time and bring it back to the body for item 11D. Mr. Dick, 11D.
Yes, thank you, Vice Chair Reese. 11D is presentation and discussion of REMSA Health's fiscal year 2022 audited financial statements. Mr. Duplantis.
Barry Duplantis, with REMSA as CEO and President for the record. REMSA Health engages a qualified audit firm to conduct an annual audit of its financial statements each year. REMSA Health's fiscal year begins on July 1st and ends on June 30th of each year. REMSA Health's fiscal 22 audit was completed in December 22 and presented to the district health officer as part of its franchise compliance on December 22nd, 2022. Once again, we received the highest opinion available from our auditors. Over the last year, REMSA Health achieved a positive change in net assets of approximately $1.9 million on a generally accepted accounting principles basis. It is important to note that of that $1.9 million, $543,000 of gain was principally from the sale of a CareFlight aircraft that was older in years and only used as a spare. So having said that, in essence, REMSA Health earned $1.4 million from ordinary income on $55 million of revenue, resulting in a 2.5% net income from recurring operations. For fiscal 2022, REMSA Health carefully managed cash and financed all expenses and capital purchases with available cash. As of June 30th, 2022, REMSA Health held sufficient cash to cover over 2 months of operating expenses. Long-term debt was down to $1.1 million at a fixed rate of 3.05%, and the maturity of that debt goes out to June 26, 2028. In fiscal 2022, REMSA Health's board approved $1.4 million for both the purchase of additional ambulances and the refurbishment of others, as well as pay for the purchases of related equipment such as gurneys, radios, and monitors. Again, all purchases were paid in cash and no new debt was taken on. This level of capital reinvestment is consistent with capital spending in the prior year. Also, I'd like to note, in May of 2022, this board allowed REMSA Health to increase its average bill to $1,950 for the purpose of improving wages for REMSA Health's employees. This support was greatly appreciated and honored. We took care of our workers with every bit of what you allowed us to generate. REMSA Health's philosophy and culture is centered on its employees and the community. In the past year, REMSA Health adopted a 40-hour work week for its field personnel, and we provided our workers with a 3.5% wage increase in July 2021. REMSA Health, as I mentioned in my previous comments, REMSA Health employs approximately 600 people, most of whom live and work here in this community. As an organization, REMSA Health continues to look for opportunities to improve efficiencies and expand patient care in our growing region. Attached in your packet is a complete set of the audited financial statements, along with the auditor's comments and opinions. And as I said, we received the highest opinion that we could have that's available from a third-party auditing firm. That said, I'm happy to answer any questions that you may have with regard to our financials.
Thank you, Mr. Duplantis. I'll bring it back to the board. Are there any questions?
I have a question, Barry. In the 1.4 million for purchasing of more ambulances, how long do you project that's going to carry you through for with the announcement of, of continued growth in Washoe County and the announcement of some more large manufacturing coming in here?
Thank you for that question. It's an excellent question. And let me say that even as I speak to you right now, because I'm referring to fiscal year 2022 that ended on June 30th of 2022. But that said, even since then, we have placed orders for ambulances. We continue to do a combination of things. We purchased Type 3 ambulances, which are the larger box-style ambulances. And for those, we typically recondition those and remount them onto new chassis. We have, I believe, 4 of those on order as we speak. And we also use the transit van style, which is a Type 2. And I think we have 9 on order of those. So one of the things you may have seen and heard even in other council meetings is the long lead time on getting equipment. We, like everybody else, are suffering the same phenomenon. So we actually leaned forward as we came out of 2022, and we placed orders, and we expect to have deliveries throughout 2023 and going even into 2024, because there's no doubt we have to lean forward in order to meet the need of the community.
So back to my question, you think that will cover you through 2024 then? Is that what you're saying?
I think that what I've got right now, we're going to receive and put in service, and then we're going to evaluate how we're doing relative to staffing and equipment that we have available. Fortunately, we do work very closely with our board, and we have discussions about readiness and what equipment we're going to need for various phases of being ready in the community. So having said, I guess the answer to your question is for 2023, I do feel comfortable that we have what we need. And then as we get into second half of 2023, in fact, as we move into May and June, we'll be assessing where we are and what we need for 2024.
And what kind of lead times are you looking at?
Right now, lead times on equipment is about a year to a year and a half, quite candidly. Just depends on the level of equipment that we're asking for. Such other equipment like the ancillary items like stretchers, monitors, the lead time on those is about 10 to 12 months.
Thank you.
Excellent questions, Dr. Clacking. Any other questions by the body? Hearing none, I'll go to Madam Clerk. Any public comment on this item?
No public comment, Chair.
Thank you. Okay, Mr. Duplantis, I'm not going to let you get away that quickly. We're going to close this item, but I'd like to get a picture with you and the board. So if you wouldn't mind, we're going to come off the dais and do that for just a moment.
You gotta. Okay, I'll get it. Bring it in. We're looking, we're smiling, we're happy. Yay, Barry.
Mike, you're a little far.
There you go. That looks great.
Thank you.
Thank you.
Okay, Madam Clerk, can you get us back on track? I believe we'll be on item 12. Is that accurate? Okay, Mr. Dick, you want to start us off here?
Yes, thank you, Vice Chair Reese. Item 12 is a fee waiver and a variance request from the Nevada Administrative Code regarding disposal of waste, and this is for the Incline Village General Improvement District public bathing facility permits for burnt cedar pools. So with that, I believe, Ms. Dixon, are we going to go straight to Mr. English? Mr. English, please.
Clean.
Good afternoon, Mr. Vice Chair. Congratulations on the new position. Good afternoon to the remainder of the board. Good choice. I am here before you, as the health officer Dick stated, to present a variance request that is for the Incline Village General Improvement District for their burnt cedar pools. They have a large pool and a baby pool, as they call it, down there on their beachfront property. Over the past year, we did construction. They completely rebuilt that pool, but they did not actually rebuild the pump room itself. From when we went to do our final inspection at that time, our staff went all the way through the pump room and determined that as part of their final inspection, they did not have a proper air gap for the pump system, and that is to protect our the recirculation system, the filters, and the pools, ultimately the bathers, from any contamination from any backwash. So with that, we did our research. We found that this pool predates any records of the health district, including any records of my employment here, pre-1992. And so therefore, it actually predates a lot of the safe drinking water requirements and regulations that are currently in place, and potentially even some of these backwash requirements. We came to an agreement with their engineers that they could operate, since they had been operating for the last 31 plus years under this format, while they did some research and we did some research to see if any previous variants had been approved by Environmental Health, the Board of Health, and the State Board of Health. We could not find anything. IVGID, as they're generally referred to, did their due diligence. They could not find a simple engineering solution to the backwash air gap issue inside their pump room. The only solution they potentially could have proposed would have been to install a container to pump the water into so that it would gravity flow to their sewer system. That actually potentially could have caused a larger environmental contamination and risk due to that small room and its proximity to the lake and the volume of water pumped by those large filters. Therefore, as you see in the staff report, they produced the engineering justification to show that the outfalls of the sewer system, the alarm systems, and at their large pump station adequately meet any risk of contaminating our filtration system for the swimming pool, and therefore protecting our citizens throughout the community. So supporting this variance will support two strategic objectives of the Board of Health and the Health District, which is healthy lives and a healthy environment. So approving this variance will both meet the needs of our regulations. It'll memorialize what has been designed and works inside that facility. We have to date never had a sewer backup in that manhole. We have never had a release to the lake, and we've never had a release into that pump room. We feel confident with IVGID's General Improvement District and their Public Works Department that based on the proximity to Lake Tahoe, they will respond and clean up any sewage backup prior to it ever getting into the pump system or to Lake Tahoe. Additionally, because we're not sure the history of this or the design, we are asking that this board also waive the variance fee that's normally $742. There is no fiscal impact to us or the health or IVGID if this is approved. So with that, I would recommend the approval of this variance request. From here, we'll take it to the State Board of Health for final approval, as we have adopted state law by reference. I'm available for any questions.
Mr. English, thank you for the presentation. Outstanding work on your part. I'm going to go first to the board and see if there are any questions from the body. Dr. Novak.
My question is, will this variance only apply to this pool in this situation? We're not starting a new precedence, are we?
No, we are not. So this will actually apply to both pools. So both pools share the same sewer discharge system. And actually, if they go into a major modification or they replace, replumb, or redesign that building and that clubhouse, they will actually put a air gap in that location. But it will take a major redesign.
Okay, good, thank you.
Any additional comments from the board? I'll go to you, Mr. Brown.
I'd like to make a motion to move to approve the fee waiver and variance request from Nevada Administrative Code 444.176, disposal of waste, and Section 2. The variance request is for the Incline Village General Improvement District Public Bathing Facility Permits number H20-0124 PB at Burnt Cedar Large Pool. It's a Burnt Center waiting pool.
Okay, I have a motion by Mr. Brown, second by Dr. Novak. Madam Clerk, did I take public comment or was there none? I'm so sorry.
No public comment, Rich.
Thank you so much. Okay, we've got a motion and a second. Any discussion on this item? Hearing none, I'll call for the question. All those in favor, please signify by saying aye and marking on your tablet.
Aye.
Aye. Any opposed? Motion carries unanimously.
Thank you. Appreciate your time and consideration. We'll ensure when this gets approved by the State Board of Health, you're aware of that through the Division Director's report.
Thank you, Mr. English. Okay, that'll close item 12 and now move on to item 13.
Yes, item 13 is a Nevada legislative process presentation for the board. It's provided by Ms. Joel Gutman-Dodson.
Miss Gutman-Dodson, what a privilege. One of my favorite people in Reno, so always a joy to see you at the podium. Take it away.
Thank you. Good afternoon, Board. Hope everybody's doing well. We're going to do just a brief presentation because I know most of you are pretty engaged. I created this presentation for our general staff meeting earlier this month, just to give an overview of the legislative process. I think some of the details about how a bill becomes a law, not everybody may be aware of. So just a quick overview, and then I will, in the next agenda item, we'll talk about our legislative principles and priorities. So as you all know, or if you don't, our session starts February 6th, which is it's always the first Monday in an odd numbered year. So it's starting, it's coming. And we're just gonna do a quick overview. For the general staff meeting, I ran out of time, but I really wanted to convey why a government agency, why the health district has its own dedicated lobbyist. And so we'll just go over that pretty briefly. But just to start with Nevada facts, so we're one of only 5 states that still has a part-time legislature, meaning we only meet once every 2 years, and we have part-time legislators. So it's largely a volunteer job. They mostly have full-time jobs, so it's a big ask for people to do, and it doesn't just end, it's not just during session, it is during the interim as well. A couple other cool things I think about Nevada is we were the first state in the nation to have a female majority, and we still do. And actually this session, 18 out of 20 committees will be chaired by women. So this is old news, but, and we had our new governor give his State of the State speech this year, but we have a new governor, and he is from a new party, and the only thing we need to talk about here is that we have a Republican governor, and our 2 houses in the legislature are Democratic, so we will see how that goes. A breakdown of our legislature, excuse me. We have 2 houses. The assembly is made up of 42 members. They're 2-year terms, meaning that they have to run every session. Currently, the Democrats control with a super majority. There are 28 seats. They hold 28 seats, and Republicans have 14. The House majority controls the committees and what bills are brought forth. So that's really important to know. And a supermajority means that the Democrats this session do not need one Republican vote if they want to pass anything that requires a 2/3 vote. And anything that requires a 2/3 vote has to do with money. So a fee increase, a tax, anything that has to do with money typically requires a 2/3 vote. So that's the Assembly, and the leader of the Assembly is Speaker-elect Steve Yeager. And this will be his first session as leader. The Senate is considered the upper house, and it is made up of 21 seats. They are 4-year terms. Our current majority leader is Nicole Cannizzaro, and right now the makeup is a 13-8 makeup, meaning the Democrats are one shy of a supermajority, meaning that they would need one Republican to vote with them for a fee increase or tax, meaning that that one vote has a lot of power. Again, their committees will all be chaired by Democrats, and there will always be one more Democrat on every committee than the House in minority. So I was going to do this, but the sound's not working very well. This might be a nice jog down memory lane for some of you. Saturday morning cartoons. How a bill becomes a law on Capitol Hill, but we're gonna skip over that. So this is how a bill becomes a law, and this is just a very general overview. It can get really messy, as Michael Brown knows, and there's all sorts of special rules and rules waived and things that don't make any sense at the very end, but in general, this is how a bill becomes a law. A bill starts as a BDR, and then it is drafted from the LCB, which is the Legislative Council Bureau. They draft a bill, and then the bill has to be introduced on a floor, either floor, House or Assembly or Senate, has to be introduced and recommended and assigned to a committee. Then it has to be heard in a committee. And that's where the lobbying happens. That's where the testifying happens. That's where people can weigh in on the bill. Then the bill has to be voted out of that committee and brought back to the floor. Then it has to be voted on the floor, and then it would go to the other house, and then it has to go through all those steps again. And then if it makes it through all those steps in one house and another house, but there's changes in the second house, it has to go back to the first house to be reconciled. A bill can be passed out of the House and signed or vetoed by a governor, and that happens. Not a lot, but it happens. And what I wanted to convey is how much happens in 120 days. So typically there's between 13 and 1,600 BDRs introduced. About 1,300 of those become bills. About 1,000 of those are heard, and about between 600 and 800 become bills. So all of those things happen in 120 days. Weekends included, and working weekends typically don't start until May, I would say. So there's not a ton of time for things to really there's not a ton of time for a legislator to make everything their priority. So that's where a lobbyist comes in. That's where they're talking to chairs of committees to make sure their bill gets heard, to make sure their bill gets out of committee and makes the deadlines. So it's a 120-day calendar. It starts on February 6th, and then the first big deadline is April 14th, and that's committee passage. So your bill, in order for it to live, needs to get out of the first committee by April 14th. Sometimes we love deadline days because a bunch of bills die and you don't have to worry about them. But sometimes you're working overtime to get your bill heard by that day. One nuance is if there's any sort of money attached to a bill, deadlines are waived, so they're exempt from deadlines, because the money piece comes at the very end. Oh, I forgot to mention the first thing. So our legislative sessions are obviously for bills to get passed, but the biggest, I'd say, of equal importance is our state budget gets passed. So by the end of 120 days, it is required that our state budget is passed, and it is a balanced budget. So the incoming governor or the governor, whether it's incoming or not, presents a budget which just got introduced this week. He presents the budget to the legislature, and then the legislature approves it. So there's a lot of things that have to be funded, and then there's quite a few $1 billion that are there to negotiate with, we will say. So these are the committees. We spend, as a lobbyist, I spend most of my time in Health and Human Services. Those are where I have probably my best relationships with legislators. And so most of our bills go through there, but if there's any money attached, which there usually is, they also have to go through fiscal committees. This is just a picture of what a committee room looks like. And then, just to relay why we need a lobbyist, I didn't start, this wasn't my career path starting as a lobbyist. I'm a social worker. And so I had always assumed that lobbyists were big fancy people smoking cigars and that had big fancy clients, and some people do, like Mr. Brown. But there's a lot of people that have a lot of big clients, gaming, energy, mining. Those are all very heavily represented industries. But what's important to know is that if you want your voice heard, you can be heard there. You can advocate for whatever you want. So there are government lobbyists, there's a Washoe County lobbyist, there's a big Clark County team that comes up. There's lots of nonprofit lobbyists that are unpaid. People go and testify on bills in their own free time, which is, I have a lot of respect for that. So last session, there were 705 lobbyists for registered in Nevada, and there are only 63 legislators that make up the body. So when you think about that, it's my responsibility to get what we want passed. It's my responsibility to get it across the finish line, because they don't have the time to do it. So that's just a quick overview. We're going to talk about our legislative principles and priorities in the next item. But these are themes I saw as the BDRs were dropping. A lot of language for bills has not come out yet, but workforce and reimbursement for education is a big thing happening. Tuition reimbursement, things like that. Workforce pipeline. Actually, affordable housing isn't as big of an issue that I thought it would be, but I did see a couple BDRs relating to it. Education, every governor I've ever seen is the education governor of the times. But there's a lot of money proposed towards education right now. Healthcare, we have some Medicaid increased rates happening, and behavioral health is a big priority this session. So that's my summary.
Ms. Gutman-Dodson, thank you so much for the presentation. It's often a curious thing how the sausage is made, so it's nice to have someone who can explain it. I'm going to bring it to the body and see if there are any questions. We are going to have a second item here just momentarily, which may be more specific and which will require action. So I'll just ask at this time, does anyone have questions on the presentation? Mr. Brown.
Yeah, I'd just like to make a comment that great presentation, Joel. But the question you posed to why do we need a lobbyist? I got to say, the last 3 sessions I've been able to work with Joelle down at Carson City. She's done a phenomenal job. You see 700 and some lobbyists, and that seems to keep growing. But, we team up together on a lot of issues, and we look at those issues that we're facing here in the north and in the south and try to get what's best for our different organizations. And Joel's always been, I got to say, very good at the collaboration and working with everybody down there, and I really appreciate that. We talk quite a bit during the session and in between, but you do a great job, and thank you very much.
Thank you, I appreciate that. And to your point, it's so true. You can't, Washoe County Health District doesn't mean a lot if we're just going at something alone. We partner with Southern Nevada Health District immensely. We're kind of like a duo. The Nevada Public Health Association, and then lots of different advocacy groups we really rely upon because it doesn't happen alone. And we have to remember as Northerners, over 2/3 of our legislators are from Southern Nevada. So they're like, some of them have never even been to Reno, except the airport. So we have to remember that. And that's where our Southern Nevada lobbyist is very helpful for the health district because he has different relationships than I do. So thank you.
Okay, any additional questions on this presentation item? Hearing none, I'll go to Madam Clerk. No public comment on this item, I don't believe.
No public comment.
Thank you so much. I'll close item 13 and move directly to item 14. Also, Ms. Gutman-Dotson.
Thank you. So every session we bring forth our Washoe County Health District legislative principles and priorities. And we do that because the session moves so quickly that there's not time to bring it to our body, to you, for every situation and every bill so that I can get approval whether we're going to testify in one way or whether we're going to push for some sort of policy or something. So we lay out some principles and priorities that I work with so that I can report back and know that you will be in line with what I'm doing down there. There will be updates, monthly updates, of course, but sometimes we have to move faster than a meeting is agendized. So we have principles and priorities, and we have to get your approval on those. So I'm just going to summarize them. They're laid out in front of you, but I think our principles and priorities shifted after the pandemic. Our whole body shifted, everything shifted, and we realized that we really had to work with other government entities, and we learned how to pivot overnight, and we've done a whole lot of things. And so we take that into every session now, I believe, that public health is really the backbone of keeping our economy going and things like that. So our first principle is partners providing service to our shared constituents. And I'm just going to go to the second paragraph. The District Board of Health recognizes that local governments in the region have numerous areas of mutual interest, and when possible, a cooperative and integrated approach to legislative relations that best serve the interests of residents and our government. With our recent experience, all types of governments putting aside their differences to focus on the safety of its citizens, we have proved and hopefully set precedents for a continued shared mutual interest in the public health and safety of all Nevadans. So that's principle one. Principle two is to prevent, protect, and promote. The DBOH supports the enhancement of public health in a manner that ensures that resources are spent where they can be most impactful while adhering to the monetary constraints of the state and local governments. Our financial model must align with the needs of the community, and public health monies must be protected and preserved. Principle three is local flexibility. We, as a health district and a district board of health, should be able to have discretion over how our money is spent. So local health boards require discretion to deliver state programs and services, particularly in scenarios when funding streams are reduced and diverted. We oppose legislative and budgetary actions that reduce local control and adversely impact our board's ability to execute its missions. And that goes in line with principle number 4, unfunded mandates. the District Board of Health believes that the Nevada State Legislature should not impose mandated functions, activities, or regulations on local government without providing financial resources or the means to meet the cost of carrying out the mandate. So we do not support unfunded mandates. And then we're going to move to our priorities. So those are like the principles that I keep in mind when we decide to act on a bill or become vocal with a bill. And our priorities are really pretty limited. This session, we used to have more specific targeted bills that we were after, but this session we are really focused on just our Public Health Improvement Fund. So getting some non-categorical funding for public health, for health districts throughout the state. So, and like I said before, together with the Southern Nevada Health District and the Nevada Public Health Association, we proposed one major bill this session to the interim health. And it is a BDR right now, but it has not become a bill because there is money attached to it. So it's called the Public Health Improvement Fund, and the bill would establish a Public Health Improvement Fund to be administered by the Division of Public and Behavioral Health. The fund is non-categorical, and the monies distributed to the local health authorities will be utilized for their own priorities and needs. So it would be at your discretion how we use the money, and that would be different in Southern Nevada versus us. So right now, all the money we receive from the state is very prescribed. It's categorical. And what we learned during the pandemic was we needed dollars to be able to pivot quickly. And we're going to face other emergencies that don't get as much federal funding as this one did. There's going to be state emergencies and local regional emergencies where we don't get flushed with cash. So we need money to be able to respond to those. So the concept of the fund would appropriate $5 per capita to build infrastructure and capacity that supports foundational public health services. So $5 per capita in Nevada is roughly $15 million. And then our chunk of that would be roughly $2.5 million. And that would be annual. So it's a $30 million ask for a 2-year budget. And then I just said that we would allocate the funds based on population to public health authorities. So it would go to the health districts, and then the rest of it would go to the state for who serves the rural counties that aren't covered by a health district. And then the second priority is more of a defense. It's not something we're presenting as a bill or we are fighting for. It's more of a cautionary tale. We have seen it unfold in many states throughout the nation. There's been a lot of legislative action towards limiting the authority of boards of health and health officers. So there's been hundreds and hundreds of bills introduced and many passed, both at a state and a local level, that take away the right of a governor to declare an emergency and takes away the authority of a health officer to make the necessary calls that he or she needs to make. It also, many bills changed the composition of district boards of health. They removed health officers who had experience in public health and replaced them with things that were politically aligned. It became very political. So this is more of we're keeping our eyes out, that we don't want to see something like this happen that could potentially threaten the authority of the District Board of Health and our health officers throughout the state. So those are our two main priorities. We also have other things, of course, that we're focused on that align with our strategic plan and our CHIP. Behavioral health is always an item that we pay attention to, and we align with the Washoe County Regional Behavioral Health Board. And then we're always looking at things that can intersect with public health. So affordable housing, health equity and disparity, things like that. So those are the principles and priorities for this session.
Thank you, Ms. Gutman Dodson. Appreciate the really in-depth analysis that you've given to it. I'll start off by asking if there are any questions for the body. I don't see anything, but I will make a couple of comments. I appreciated the second priority, perhaps, given the experience we've had here locally. I am certainly very happy that you're following closely the national landscape as it relates to the authority or powers of the District Board of Health and its health officer. I see with some concern nationally where people in the District Board of Health officers position are leaving this profession in droves, and it really is creating a health emergency. And I am very fortunate and thankful every day that we had the District Board of Health officer, Mr. Dick, in the position he was in during a very difficult time. And so I extend my thanks to him, and really as a way of saying to you, let us continue to preserve and protect not only the integrity of the function, but also the person. So I will be interested to follow whether there will be any discussion in Carson about legal and criminal penalties for harassment of health officers. This is something that I think is challenging in this landscape, of course. And so I will watch with some interest in the way in which this session develops. Second thing I will comment on is that in terms of how you interact with this body, it does move very quickly in 120 days. And so for my part, just being kept abreast of changes in any meaningful way, there will be things which happen on a daily basis that you certainly cannot communicate to all of us. But if there are major initiatives and ones in which you require our support or information or knowledge about, just make sure that it's communicated to us in some manner. And I'll leave that to you and Mr. Dick to determine when that is. And of course, for those of us who sit on other bodies, we're constantly getting information about other priorities. So maybe today I'm hearing about the priorities of the health district, and next week it'll be about RTC's priorities, and then the City of Reno's priorities. So all sorts of things. And of course, if I see anything that I think has an overlap with you, I'll share them with you. And similarly, I would imagine that you'd have the same task here. So you have a tall task. 120 days is a very compressed schedule, but I know that you're up for the task. So I appreciate the hard work that's gone into getting this moment. I was there on Monday night for the State of the State, and really am very hopeful for our legislative cycle, and interested to know the governor's thoughts on a number of things that impact this organization. And so I will sort of be waiting with bated breath, as will you. So thank you for your time and presentation. And I think, if I'm not incorrect, we'll have to have a motion on this item. And so I'll come to Madam Clerk and remind myself, A, is there any public comment?
No registered public comment.
Thank you so much. So at this time, I'll look for a motion from the body.
So moved.
Okay, I have a motion. Is that
Second.
Mr. Novak? And a second by Dr. Denko. Any additional discussion at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye and marking on your tablet.
Aye.
Aye. Any opposed? Hearing none, motion carries unanimously. Thank you.
Thank you. Hopefully, I'll have some money to bring back to you.
Always a happy day. Money makes the district happy. Okay, District Board of Health Officer Dick, are we on item 15?
Yes, we are, sir. Air Quality Management's monthly report. Mr.
Vega,
Francisco
welcome.
Vega.
Thank you, Vice Chair. For the record, Francisco Vega, Director of the Air Quality Management Division. Apologize about my voice. I got a little bit excited at the previous UNR basketball game, so apologize about that. But I did want to highlight one thing in my director's report, and actually this was a previous commitment of mine to keep the board updated on anything that may impact the National Ambient Air Quality Standards. And this is under item B. The EPA is proposing a change to the ambient air quality standard for PM 2.5. Specifically, they are proposing a standard in the range of 9 to 10 micrograms per cubic meter, and seeking comment on a range as low as 8 micrograms per cubic meter. And then also on the 24-hour standard, proposing to leave that as is, but also seeking comment on a standard as low as 25 micrograms per meter cubed. And again, the current standards are there. It's 12 for the annual standard, and then I believe it is 35 for the annual standard. So again, this may impact Washoe County. We're actually currently assessing what impact that may or may not have. Again, primarily, the biggest impact that we have had in regards to PM 2.5 has come from wildfires. So just wanted to mention that. Any questions or a discussion on that part of it?
Any questions about this item? Okay. Director Vega, did you have something else?
I did. I just also wanted to mention that for our Air Pollution Control Hearing Board, we will have a vacancy on that board. And again, this is something that was brought by Councilman Dare to brief the board information on any kind of vacancies on any kind of boards. So we will be putting out a press release looking for anybody in the community interested to join the board. But again, if you know of anybody, please have them apply.
Thank you so much, Director Vega. I appreciate the report. And let me ask, Madam Clerk, do I need to have public comment on each of the individual 15A, B, C items, or is it 15 as a whole?
We don't have action on these items, so there is no public comment.
Perfect. Thank you so much. Thank you, Director Vega. Appreciate you. We'll move on to 15B. Is that Ms. Latras? Thank you so much. And Mr. Dick, just if I'm out of turn or speaking over you, you let me know, because I am new in the chair.
You're doing great.
Good afternoon. Lisa Latridge, Division Director for Community and Clinical Health Services. I just have a couple updates to my report. Our maternal child health team will be presenting cases for the Nevada Childhood-Led Advisory Board on February 6th. We have 6 cases that we're going to be reporting that we've received since the last quarter. And what we work, we collaborate with the state on these cases. They mainly review the ones that are lead levels of 3.5 to 9.9 and do follow up with the families and make sure that they're seeing the doctor. For cases 10 and over, the nurses go and do home visits. They do a complete assessment to try to determine what the cause of the high lead levels are in the home. And some of the things we're seeing are environmental factors, food, toys, makeup, etc. So of the 6, I'm happy to say that they're all under 10, but because there were 6, we took half and the state took half. So we're working on those. Exciting news for CCHS Pause for Love will be visiting the clinic on February 6th. I announced it at the staff meeting this morning, and staff were so excited. So they will be in our waiting rooms for clients and staff, and they're, everyone's excited to come and get a little pet therapy. And we're hoping to make this a monthly event and even extend it to all the other divisions as well. And then 2 of our WIC staff did a Spanish radio segment today to talk about the benefits of WIC and how you sign up. And this is just one of several segments that we have done with WAN 101.7. And then the WIC waivers were renewed and will be reevaluated mid-April. This means that visits will continue to take place remotely unless the clients choose to have an in-person visit. And just a little bit of information was shared at our staff meeting this morning that one of the WIC programs, or several that have gone back to all in-person visits requiring it, are seeing a pretty major reduction in their clients. So something that WIC is looking at to see if, remote is better. Just one thing that came out of COVID. That's all the additions I have, but I'm happy to answer any questions you might have.
Thank you, Ms. Latras. Excellent report, as always. I'll ask my colleagues if anyone has any questions at this time. Okay, hearing none, thank you so much for the time this morning. Item 15C, Ms. Dixon.
Good afternoon. Once again, for the record, Erin Dixon with Environmental Health Services. Just want to do a few highlights from the report that you have in front of you. There's a little bit of an overview in here about we changed our structure this month. After a lot of thought, deliberation, discussion, data analysis, very lengthy conversations, we've decided as of January 1st of this year that we changed our structure in environmental health to be a specialist structure, more of a specialist structure. Previously, we were generalists, which means our inspectors would go out and during the day, they may have a pool inspection, an IBD, which will be a tattoo parlor. They'd be responsible for a hotel, a school, a restaurant. It was very broad. And that structure works really, really well for small health districts. Washoe County is kind of in between. We're not quite one of those really incredibly large health districts, but we're also not a small health district. So we changed on January 1 to a specialist. So each of our inspectors will have more of a focus. Many of them will only be assigned to one program, which would be really exciting for them as they can really become experts, understand the regulations very deeply, and we working that way. So a number of our teams this month changed programs. So there's a lot of training and learning and opportunities that are happening right now. It's not a perfect structure because there is no perfect structure, but everyone on the team really is committed to making it work and understanding that the benefits that this structure will have. I wanted to make sure that you were aware of that. Moving on to the individual programs. Under our food safety program, you've been watching the news, our food safety program has been very busy in the past few weeks. Very proud of the hard work that they have been putting in. Their dedication to food safety in our community and the desire to really work with businesses and help them be successful, and understanding that safety is our top priority. We are still accepting applicants for the 2022 Excellence in Food Safety Awards. So winners will receive special recognition on our Washoe Eats mobile app. They'll be part of future advertising efforts, and they will, when they win, they will be presented a certificate by you guys. So restaurant owners can apply directly at our website. Our food disease investigation program also went out and within an event venue that was cooking food without a food permit. We are working with that operator to try to get them to permit the facility. And we also had a confirmed outbreak at another location. Our septic plan numbers for this past year were approximately 10% higher than the previous year, and septic-related inspections were approximately 12% higher. So we are seeing a return to pre-COVID growth in that program. And then finally, I'd like to highlight our Safe Drinking Water program has been experiencing a number of positive water tests in some of our smaller water systems that lead to boil water orders. We're kind of at a rate that we haven't experienced in a very, very long time. The operators are doing great. We don't exactly have a specific reason for any of this, but we're working very closely with the individual operators and making sure they are following all the necessary rules. And that is it, if you have any questions.
Thank you, Ms. Dixon. Let me see if anyone has any questions from the board. Ms. Dixon, for my part, I do have a question, and perhaps this is something that we can coordinate offline, but I'm interested to know a bit more about some of the street vendor operations. And so let us find time to, with the opportunity with Mr. Dick and yourself, for me to learn more about it, because it appears to be an increasing frequency, and I understand there have been some issues in the last several years about it, so I'd like to meet with you offline.
That would be wonderful.
Great.
We have a strong education component that we developed this past year to let people know how to become permitted food vendors, and we work very closely. So we'll be very excited to sit down and talk to you about that.
Awesome. Thank you so much. Thank you for the report, and I'll close this item and move down to item 15D. That's Dr. Diao.
Good afternoon, Board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I don't have anything to update or change, just a few highlights on our recent report. First is our current actions on our Medical Reserve Corps volunteer recruitment. The Washoe County Health District's Medical Reserve Corps, or MRC volunteer, include both medical and non-medical community members to support public health and emergency response efforts. And during our COVID-19 pandemic, volunteerism through the state has really surged, and so did our membership registration with our MRC program. But, and also we were really, really grateful for all that additional help received through our post and pod efforts. However, towards the end of this emergency declaration, active volunteers has dropped drastically, and the response to requests for volunteers were much less. And so by May of 2022, we were awarded a short-term MRC Respond, Innovate, Sustain, and Equipped Award from NACCHO. And this allowed us to assess and clean up our membership and bridge some of the gaps. And knowing that not all members can keep up with the active membership and respond to volunteer requests, and knowing the demand of medical volunteers during disasters and emergencies, we directed a portion of that funding towards recruitment efforts for medical volunteers. And so we ran a media campaign November through December of 2022, which included online pre-roll and Facebook video reach ads. And we sent out postcards to licensed medical facilities at the end of last year, focused on recruitment to our MRC volunteer program. And then in our hospital preparedness, we have started working on our annual hazard vulnerability analysis assessment and resources and gap analysis with the healthcare partners. The data collected through this will help us identify top goals and resource needs for the healthcare partners, and help our exercise and training planning and resource allocation for the upcoming fiscal year. And in our epidemiology program, our program has completed and published the 2021 annual communicable disease report. So some increases seen are more noticeable in RSV totals. This is not surprising, even though this season right now, we've already seen a large surge in RSV numbers. Last flu season's RSV was also much higher than previous seasons, because the uptick began really early in June instead of the usual fall timeline that we have. And outside of respiratory, primary and secondary syphilis also did see a slight uptick in the 2021 totals compared to 2020. So this report is actually available on our website right now publicly. So if you want to read that for more details about disease trends that we've seen in the past 5 years, please do so. And that's all my updates. I'm happy to answer any questions you may have.
Thank you, Dr. Dow. Any questions from the body? Dr. Novak.
Dr. Dow, are we seeing a shift in bacteria or viral strains for the flu this year like we usually do?
Right now we are still at H3N2, so that's fortunate. We had other years where we did have a flu A uptick, and maybe by the around February or March we start to see a flu B. So right now we're still in H3N2.
Good.
If there are no other questions, I have one question, and I apologize, Ms. Gutman-Dodson has left, but perhaps I just want to make sure that you and Ms. Gutman-Dodson are coordinating your thoughts and efforts about what might happen in the legislative process. I'm a very strong proponent of following the science, and so when someone with your background and credentials is before me and lays out the type of scientific analysis that you do, obviously I think that's the best way for policy to be driven by the organization, which informs me that you and the health officer and Ms. Gutman-Dodson ought to be very closely coordinating whatever efforts are undertaken in Carson. So it sounds like, and based on your nodding in agreement, it sounds like that is a possibility.
Thank you. Thanks for that input as well. Yeah.
Certainly. Thank you so much. I'll close this item now as 15D and move on to 15E. Thank you so much.
Yes, thank you, Vice Chair. I just have a couple of things I wanted to highlight. I want to thank Mike Brown for joining us for a celebration of our health heroes. We had a fun luncheon event on January 12th, so thank you for that. And also just wanted to note that the board has authorized me to add fees to the community and clinical health services fee schedule for clinical services, so those aren't delayed in providing those services. And so I did note several new fees for tests and treatment that we've added to the schedule. So I just wanted to make the board aware of that. And that concludes my report. I'd be happy to take any questions.
Any questions? Dr. Novak? No? Okay. Thank you, Mr. Dick. I appreciate the update, and thank you for the very thorough staff report as well. That helps me to digest what I need to know, so thank you for that. Okay, we'll close out the items that are in 15 and bring it back now to item 16, which are board comments. Are there any at this time? Mr. Brown.
I'd just like to say thank you to the health officer for the luncheon. It was quite informative and informative. You couldn't believe what's going on here. And the staff and everybody that attended are doing an excellent job here, as we well know. But really enlightened me to a lot of things that are going on here. And right, in a manner that's very efficient. So thank you.
Anything else? Okay, we'll close item 16 and bring it to the last item. Madam Clerk, is this something you wish to have a motion made on?
You can, it is an action item, and usually Chair will call for it.
Well, given that I'm the vice chair and just chairing for today, I'm going to just simply adjourn the meeting.